In the sterile corridors of Walter Reed Medical Center, where pride and protocol ruled supreme, a young nurse was about to challenge everything the medical establishment believed about healing. What happened next would make hardened Navy SEAL commanders question their own understanding of courage, force arrogant doctors to swallow their pride, and prove that sometimes the most powerful medicine comes not from a prescription pad, but from the human heart. This is the story of Sarah Chen, a quiet night shift nurse whose unconventional methods were dismissed as foolish by her superiors until the day a decorated SEAL commander did something that had never happened in the hospital's history. What he did in front of dozens of witnesses would spread through military circles like wildfire, change hospital policy forever, and transform how an entire medical center viewed the true meaning of service. Some called her crazy. Others called her dangerous. But, when the dust settled and the impossible became reality, even her harshest critics had to admit one thing: sometimes the person everyone underestimates is exactly the one who changes everything. Sarah Chen never planned to become a nurse, much less one working the graveyard shift at Walter Reed Medical Center. The daughter of immigrants who owned a small restaurant in San Francisco's Chinatown, she had grown up expecting to follow her parents into the family business. But life had other plans. At 22, fresh out of nursing school with student loans that felt like mountains, Sarah found herself walking through the imposing doors of one of America's most prestigious military medical facilities. The building itself seemed to command respect, its marble floors polished to mirror brightness, walls lined with portraits of distinguished military leaders, and corridors that echoed with the measured footsteps of personnel who carried themselves with unmistakable military bearing. Sarah stood barely 5 feet 3 inches tall, with long black hair that she kept pulled back in a practical ponytail and eyes that seemed too large for her delicate face. Next to the towering figures in crisp uniforms and white coats, she looked almost childlike. But those who looked closer might have noticed the steel in her dark eyes and the way her jaw set with quiet determination when she faced a challenge. Dr. Marcus Thornfield noticed her immediately, though not for reasons that boded well for Sarah's future at the hospital. As the chief of internal medicine, Dr. Thornfield had built his reputation on precision, protocol, and an unwavering belief that medicine was a science that left no room for sentiment or deviation from established procedures. At 58, with silver hair perfectly groomed and a bearing that commanded immediate respect, he had overseen the treatment of generals, congressmen, and foreign dignitaries. He did not suffer fools, and he certainly had no patience for nurses who might challenge his authority. On Sarah's first day, Dr. Thornfield gathered the nursing staff for what he called an orientation, though it felt more like a military briefing. "This facility operates on precision," he announced, his voice carrying the weight of absolute authority. "Every medication, every procedure, every interaction with patients follows protocols that have been established through decades of medical excellence. Deviation from these protocols is not creativity, it is dangerous incompetence." His eyes swept across the assembled nurses, lingering on Sarah with unmistakable emphasis. "Some of you may come from institutions where flexibility is encouraged. That mentality has no place here. You will follow orders, execute procedures as directed, and remember that your role is to implement medical decisions, not to make them." Sarah felt the weight of his stare but kept her expression neutral. She had heard rumors about Dr. Thornfield's reputation even before arriving. Other nurses whispered about his perfectionist standards and his particular dislike for anyone who questioned established methods. But Sarah also knew something about perseverance. Growing up in her family's restaurant, she had learned that success came not from avoiding difficult people, but from proving yourself through consistent action. The Walter Reed night shift was unlike anything Sarah had experienced in her previous clinical rotations. The patients here were not typical hospital cases, they were active duty military personnel, veterans carrying invisible wounds from combat, and warriors whose bodies bore the brutal evidence of service to their country. Many had injuries that went far beyond what could be treated with standard medical procedures. Staff Sergeant Mike Rodriguez became Sarah's first real test. A Marine who had lost both legs to an improvised explosive device in Afghanistan, Rodriguez had been at Walter Reed for 3 months. His physical wounds were healing well, but his emotional state was deteriorating rapidly. He refused to participate in physical therapy, barely ate, and spent most of his time staring at the ceiling with empty eyes. Dr. Thornfield's approach was clinical and direct. Sergeant Rodriguez needs antidepressants and psychological counseling, he declared during rounds. His resistance to treatment is typical of patients adjusting to permanent disability. We increase his medication dosage and refer him to psychiatry. But Sarah saw something different when she looked at Rodriguez. During her night shifts, when the hospital grew quiet and the formal structure of daytime rounds relaxed, she noticed things that the day staff missed. Rodriguez never slept, not really. He dozed fitfully and woke with starts that suggested nightmares. When he thought no one was watching, he would touch the space where his legs used to be, as if still expecting to find them there. One night, Sarah made a decision that would have horrified Dr. Thornfield if he had known about it. Instead of following the prescribed routine of medication distribution and vital sign checks, she pulled a chair next to Rodriguez's bed and sat down. "You can't sleep," she said softly. It wasn't a question. Rodriguez turned his head slightly, surprised to find someone actually looking at him rather than at his chart. "Sleep's overrated," he replied, his voice carrying the rough edge of someone who had learned to keep pain locked inside. "Maybe," Sarah said. "But lying here thinking about everything you've lost probably isn't helping much either." For the first time in weeks, Rodriguez made actual eye contact with another human being. "You don't know what you're talking about." "You're right," Sarah admitted. "I don't know what it's like to lose parts of yourself in combat. I don't know what it's like to go from being a warrior to feeling helpless in a hospital bed. But I do know what it's like to feel like everyone around you has already decided what your life is going to be like, and none of them bothered to ask you what you wanted." Rodriguez studied her face, searching for the pity or false cheerfulness that he had learned to expect from medical personnel. Instead, he found something unexpected: genuine respect. "What do you want?" Sarah asked. "Not what the doctors think you should want, not what's realistic or practical. What do you actually want?" The question caught Rodriguez off guard. No one had asked him that since his injury. Everyone had assumptions about what he needed, what he should feel, what his limitations were. But no one had simply asked what he wanted. "I want to feel useful again," he said finally, the words coming out rougher than he intended. "I want to matter." Sarah nodded. "Then, let's figure out how to make that happen." What followed was a conversation that lasted until dawn. Rodriguez talked about his life before the military, his dreams of becoming a teacher, his fear that his injury had made him worthless. Sarah listened without judgment, occasionally asking questions that helped him think through his feelings rather than simply react to them. When the day shift arrived, they found Rodriguez sitting up in bed for the first time in weeks, engaged in conversation with the small nurse who was supposed to have been following standard medication rounds. Dr. Thornfield noticed the change immediately during his morning rounds, though he attributed it to the increased antidepressant dosage finally taking effect. But Sarah knew better. She had discovered something that would become the foundation of her entire approach to patient care. Sometimes healing required more than medical procedures. Sometimes it required seeing the person beneath the patient, the warrior beneath the wounded body, the human being beneath the diagnosis. Over the following weeks, Sarah continued her unconventional approach with Rodriguez and other patients on the ward. She listened to their stories, asked about their dreams, and treated them as complete human beings rather than collections of symptoms to be managed. The results were undeniable. Patients under her care showed faster recovery times, better compliance with treatment, and improved emotional states. But her methods also drew increasing attention from hospital administration. Dr. Thornfield began receiving reports about the night nurse who spent too much time talking to patients and not enough time following protocols. Other nurses complained that Sarah was making them look bad by going beyond basic care requirements. The tension came to a head during a particularly difficult week when the hospital admitted a group of severely wounded soldiers from a convoy attack overseas. The influx of critical cases put enormous strain on the entire medical staff, and Dr. Thornfield's patience with anything that deviated from standard procedure evaporated completely. "Miss Chen," he announced after a particularly long day of surgeries and complications, "your approach to patient care is becoming a distraction. This facility operates on efficiency and medical excellence, not on therapy sessions and hand-holding." Sarah felt the eyes of the entire nursing staff on her. She knew this moment would define her future at Walter Reed. "With respect, Dr. Thornfield," she replied quietly, "my patients are showing measurable improvement in both physical recovery and psychological adjustment. Anecdotal improvements that cannot be quantified or replicated," Dr. Thornfield dismissed. "Medicine is a science, Miss Chen. We follow evidence-based practices, not feelings-based experiments." The confrontation left Sarah isolated from many of her colleagues, who preferred not to risk their own standing by associating with someone who had challenged the chief of medicine. But it also strengthened her resolve. She had seen what was possible when patients were treated as whole human beings rather than medical cases, and she wasn't about to abandon that approach because it made others uncomfortable. Late that night, as Sarah walked through the quiet halls of the ward, she made a promise to herself and to every patient under her care. She would continue to see them as complete people deserving of dignity, respect, and genuine care. She would listen to their stories, acknowledge their fears, and help them find reasons to keep fighting for recovery. She had no way of knowing that her commitment to this approach would soon be tested in ways she could never have imagined, or that a patient was about to arrive who would change everything she thought she knew about courage, sacrifice, and what it truly meant to serve. Commander James Mitchell arrived at Walter Reed on a Tuesday morning in March, though he barely resembled the decorated Navy SEAL whose photograph had once graced military publications. The man who was wheeled into the intensive care unit bore little resemblance to the warrior who had led countless successful missions in the most dangerous regions of the world. At 35, Mitchell had dedicated his entire adult life to serving his country in the most elite special operations units. He had survived missions that remained classified, earned commendations that would never be publicly acknowledged, and led teams through situations where failure meant not just personal death but potential international incidents. His reputation within SEAL Command was legendary, a leader who never left a man behind and who somehow found ways to complete missions that others deemed impossible. But the man lying unconscious in bed 7 of the ICU was barely recognizable as that legendary warrior. An improvised explosive device in Syria had done what enemy combatants had failed to accomplish in over 15 years of service. It had brought Commander Mitchell to the edge of death and beyond. The explosion had caused catastrophic injuries that challenged every medical protocol Walter Reed had established. Mitchell had suffered severe traumatic brain injury, multiple fractures throughout his body, internal bleeding that had required 6 emergency surgeries, and burns over 30% of his skin. But the most devastating injury was the one that couldn't be seen on any medical scan: the complete destruction of his will to live. Dr. Thornfield assembled his most experienced team to handle Mitchell's case. The patient's status as a highly decorated Special Operations Commander meant that his treatment would be scrutinized at the highest levels of military command. Success would enhance the hospital's already stellar reputation. Failure would result in questions that Dr. Thornfield preferred not to face. "This is a textbook case of severe polytrauma with associated traumatic brain injury," Dr. Thornfield announced to his team during the initial briefing. "We will follow established protocols for each injury system, coordinate care across specialties, and document every aspect of treatment meticulously." The medical approach was flawless in its precision. Neurologists monitored brain function and adjusted medications to reduce swelling. Orthopedic surgeons repaired fractures with military precision. Plastic surgeons began the long process of reconstructing damaged tissue. Physical therapists developed comprehensive rehabilitation protocols. Yet despite the medical expertise being applied to his case, Mitchell's condition remained critical. He drifted in and out of consciousness, showing little response to stimuli and no apparent awareness of his surroundings. When he was awake, his eyes held an emptiness that disturbed even the most experienced medical staff. Sarah first encountered Commander Mitchell during her 3rd week on his case. She had been assigned to the ICU temporarily due to staffing shortages, and his room was part of her rotation. The sight that greeted her was heartbreaking in its stark contrast to the man's military record. Mitchell lay motionless, connected to multiple monitors and 4 lines. His face, partially obscured by bandages covering burn injuries, showed no expression. But what struck Sarah most powerfully was the complete absence of any spark in his eyes. She had seen wounded warriors before, had worked with patients facing devastating injuries, but she had never encountered someone whose spirit seemed so thoroughly extinguished. According to his chart, Mitchell was responding poorly to all forms of treatment. Physical therapy sessions resulted in minimal progress. Psychological evaluations indicated severe depression and possible post-traumatic stress disorder. His medical team was beginning to discuss long-term care options that assumed he would never return to anything approaching his previous level of function. Dr. Thornfield's assessment was characteristically clinical and pessimistic. "Commander Mitchell's injuries are too severe for full recovery," he stated during rounds. "Our goal should be stabilization and management of symptoms rather than restoration of previous capabilities." But Sarah saw something in Mitchell's eyes that others missed, a flicker of awareness that suggested the man inside was still fighting, even if his body couldn't demonstrate it yet. She had learned to recognize that look during her time with Rodriguez and other wounded warriors. It was the look of someone who wasn't ready to give up but didn't know how to keep going. The first real breakthrough came during a night when Mitchell was experiencing severe pain that wasn't responding to medication. Standard protocol called for increasing his pain medication dosage, but Sarah had learned to read the subtle signs that indicated when a patient needed something different. Instead of immediately adjusting his medication, she sat down beside his bed and spoke to him directly. "Commander Mitchell," she said quietly, "I know you can hear me, and I know you're in pain. But I also know that you're stronger than this injury, stronger than this moment." For the first time since arriving at Walter Reed, Mitchell's eyes focused directly on another person. The look he gave Sarah was filled with such profound hopelessness that it nearly broke her heart. "I've read about your missions," Sarah continued, her voice steady despite the emotion she felt. "I've read about the men whose lives you saved, the impossible situations you navigated, the leadership you provided when everything seemed hopeless." Mitchell's expression didn't change, but Sarah noticed his breathing had become more focused, more controlled. "Right now, you're facing the hardest mission of your life," she said. "Not fighting an enemy you can see, not protecting other people, but fighting to save yourself. And I know it feels impossible because this enemy is inside you, in your head, in your spirit." Sarah paused, watching Mitchell's face for any sign of connection. "But here's what I also know, you've never failed a mission that mattered. And this one matters more than any of them." Over the following nights, Sarah continued her unconventional approach with Mitchell. She talked to him about his missions, his teammates, the lives he had saved. She read him letters from fellow SEALs expressing their support for his recovery. Most importantly, she treated him not as a patient to be managed but as a warrior who was fighting the most important battle of his life. The medical staff began to notice changes in Mitchell's condition, though they attributed them to the natural healing process rather than any external factors. His pain levels decreased. His awareness increased. Most significantly, he began participating more actively in his treatment rather than simply enduring it. But Dr. Thornfield remained skeptical of any approach that deviated from established medical protocol. "Miss Chen," he warned during one of their increasingly frequent confrontations, "your emotional involvement with patients is inappropriate and potentially harmful. Commander Mitchell requires medical treatment, not amateur psychology." "He requires both," Sarah replied, her quiet voice carrying unmistakable conviction. "His body is healing according to your protocols, but his spirit needs something different." "His spirit," Dr. Thornfield repeated with obvious disdain, "is not my concern. I am responsible for his medical recovery, nothing more." The tension between Sarah's approach and Dr. Thornfield's rigid adherence to protocol reached a breaking point when Mitchell suffered a setback in his recovery. After weeks of steady improvement, he suddenly withdrew into himself again, refusing to participate in physical therapy and showing signs of severe depression. Dr. Thornfield was quick to blame Sarah's methods. "This is exactly why we follow established protocols," he announced to the medical team. "Amateur psychology and emotional manipulation have undermined weeks of legitimate medical progress." But Sarah recognized what was really happening. Through her conversations with Mitchell, she had learned about the guilt he carried over the mission where he was injured. 2 members of his team had died in the same explosion that wounded him, and he blamed himself for their deaths. The closer he came to recovery, the more intense his survivors' guilt became. Against direct orders from Dr. Thornfield, Sarah made a decision that would either save Mitchell's life or end her career at Walter Reed. She contacted SEAL Command and arranged for two of Mitchell's surviving teammates to visit him at the hospital. The reunion was emotional and powerful in ways that no medical intervention could have achieved. Mitchell's teammates shared their own struggles with survivor's guilt, their memories of the men who had died, and their absolute conviction that Mitchell's survival was not a betrayal of his fallen brothers but a responsibility to honor their memory through his recovery. The impact on Mitchell was immediate and dramatic. For the first time since his injury, he began actively participating in his recovery rather than simply enduring treatment. He pushed himself in physical therapy, engaged with psychological counseling, and, most importantly, began fighting to rebuild his life rather than simply survive his injuries. Dr. Thornfield was furious when he discovered what Sarah had done. "You violated direct orders and exceeded your authority," he informed her during a formal disciplinary meeting. "Your actions could have resulted in serious complications to the patient's condition. Instead, they resulted in the breakthrough that saved his life," Sarah replied calmly. "You have no medical training to make such determinations," Dr. Thornfield shot back. "You are a nurse, not a psychiatrist, not a doctor, and certainly not qualified to make decisions about patient treatment." The confrontation established clear battle lines within the hospital. On one side stood Dr. Thornfield and the traditional medical establishment, insisting on rigid adherence to protocols and hierarchical authority. On the other side was Sarah, advocating for a more holistic approach that treated patients as complete human beings rather than collections of medical problems. Most of the nursing staff tried to stay neutral, but the results of Sarah's methods were becoming impossible to ignore. Patients under her care consistently showed better outcomes, faster recovery times, and higher satisfaction scores. Mitchell's dramatic improvement was just the most visible example of what was becoming a clear pattern. But success brought its own challenges. Sarah found herself under constant scrutiny from hospital administration, her methods questioned and her authority challenged at every turn. Other nurses began to resent the attention her unconventional approach was receiving, and Dr. Thornfield made no secret of his intention to find a way to remove her from his ward. The pressure was taking its toll on Sarah, but she refused to abandon her commitment to treating patients with the dignity and comprehensive care she believed they deserved. She had seen too much improvement, witnessed too many breakthroughs, and earned too much trust from wounded warriors to step back into a more conventional role. What she didn't know was that Commander Mitchell's recovery was being monitored at levels far above the hospital's internal politics. SEAL Command was taking notice of his remarkable improvement, and questions were being asked about the factors contributing to his success that went beyond standard medical treatment. The answers to those questions would soon bring attention to Walter Reed that no one expected, and would force a confrontation between traditional medical authority and innovative patient care that would change everything about how the hospital viewed its mission. Admiral Rebecca Sterling had commanded respect in military circles for over 20 years, rising through the ranks of Naval Special Warfare Command to become one of the most influential leaders in special operations. At 52, she carried herself with the bearing of someone who had made life-and-death decisions in situations where hesitation meant failure and weakness was not an option. When Admiral Sterling received reports about Commander Mitchell's remarkable recovery, her initial response was professional satisfaction. One of her best officers was healing faster and more completely than anyone had expected. But, as she reviewed the detailed medical reports and spoke with SEAL Command personnel who had visited Mitchell, she began to notice patterns that demanded closer investigation. "Something unusual is happening at Walter Reed," she told her chief of staff during a secure briefing. "Mitchell's recovery is exceeding all medical predictions, and the factors contributing to his improvement appear to involve elements beyond standard medical treatment." Admiral Sterling had not achieved her position by accepting surface explanations for complex situations. She had learned that exceptional results usually had exceptional causes, and she made it her business to understand what those causes were. Mitchell's case was particularly important because he represented exactly the kind of warrior that the special operations community could not afford to lose to inadequate treatment. Her investigation began with a comprehensive review of Mitchell's medical files and treatment protocols. What she found was a textbook example of excellent trauma care, executed by some of the most skilled physicians in military medicine. Dr. Thornfield's team had performed flawlessly according to every established medical standard.
But the timeline of Mitchell's improvement showed anomalies that couldn't be explained by medical intervention alone.
His most significant breakthroughs had occurred during periods when standard treatment protocols suggested his progress should have plateaued. Even more interesting, his psychological recovery had accelerated dramatically despite minimal formal psychiatric intervention.
Admiral Sterling decided to conduct her investigation personally.
She arrived at Walter Reed unannounced on a Thursday morning, wearing civilian clothes and carrying credentials that ensured her complete access to the facility without alerting hospital administration to the true purpose of her visit. Her first stop was Commander Mitchell's room. What she found there confirmed her suspicions that something extraordinary was happening beyond the reach of standard medical procedures. Mitchell was participating actively in physical therapy, displaying determination and focus that his medical team had not expected to see for months. But, more importantly, he spoke about his recovery with a sense of purpose and optimism that suggested profound psychological healing. "Someone here understands what it means to serve," Mitchell told the Admiral during their private conversation. "Not just the physical aspects of healing from injury, but the spiritual challenge of finding reasons to keep fighting when everything seems lost." When Admiral Sterling asked him to elaborate, Mitchell's response was immediate and passionate.
"There's a nurse here who sees us as warriors, not just as patients.
She understands that healing means more than fixing our bodies, it means helping us remember who we are and why our lives matter." Admiral Sterling made note of every detail Mitchell provided, but she also conducted her own observations throughout the day. She watched the interactions between medical staff and patients, noting the subtle differences in approach that characterized various caregivers. What she discovered was a clear division between those who treated patients as medical cases and those who treated them as complete human beings.
Sarah Chen stood out immediately, though not because she was seeking attention or recognition.
If anything, Admiral Sterling noticed that Sarah seemed to work deliberately behind the scenes, avoiding the spotlight that other staff members sought.
But her impact on patients was undeniable.
During her observation period, Admiral Sterling watched Sarah interact with multiple patients, including several who had been considered difficult cases by other staff members. In each interaction, Sarah demonstrated a combination of professional competence and personal engagement that was remarkable in its effectiveness. With Rodriguez, who had progressed from refusing treatment to actively participating in rehabilitation, Sarah provided encouragement that was both realistic and inspiring. With a young Marine who had lost an arm and was struggling with anger management, she listened patiently to his frustrations and helped him identify constructive ways to channel his emotions. But it was her interaction with Commander Mitchell that truly caught Admiral Sterling's attention. Sarah treated him not with the deference typically shown to high-ranking officers, nor with the clinical detachment common in medical settings. Instead, she engaged with him as one warrior acknowledging another, offering respect for his service while challenging him to continue fighting for his recovery. "Commander," Sarah said during one conversation that Admiral Sterling overheard, "you've spent your entire career leading others through impossible situations. Now you're leading yourself through the hardest mission you've ever faced. Your teammates are watching, your brothers in arms are counting on you to show them it's possible to come back from something like this." Admiral Sterling recognized immediately that Sarah understood something fundamental about military culture that most civilian medical personnel missed entirely. Warriors didn't respond well to pity or false reassurance, but they responded powerfully to challenges that connected their recovery to their sense of duty and honor. That evening, Admiral Sterling requested a private meeting with Dr. Thornfield. As the chief of medicine, he would be able to provide official perspective on the unusual patterns she had observed. Dr. Thornfield's response to her questions was exactly what Admiral Sterling had expected from a traditional medical administrator. "Miss Chen is a competent nurse," he acknowledged, "but her methods are unorthodox and potentially problematic. She becomes emotionally involved with patients and frequently exceeds the scope of her authority. Yet her patients show consistently better outcomes than others in the ward," Admiral Sterling observed.
"Correlation does not imply causation," Dr. Thornfield replied stiffly. "Medical recovery depends on proper treatment protocols, not on emotional manipulation or amateur psychology.
Admiral Sterling had encountered Dr. Thornfield's type throughout her military career, highly competent professionals who excelled within established systems but struggled to adapt when situations required innovative approaches. She respected his medical expertise but questioned whether his rigid adherence to protocol was serving his patients' best interests. "Tell me about Commander Mitchell's recovery," she requested. Dr. Thornfield provided a detailed medical assessment that was technically accurate but emotionally sterile. He described Mitchell's injuries, treatment procedures, and physiological improvements with scientific precision. But he made no mention of the psychological factors that had contributed to Mitchell's remarkable progress.
What role did Miss Chen play in his treatment?
Admiral Sterling asked directly. She provided standard nursing care within the parameters of her assigned duties, Dr. Thornfield replied carefully. Any suggestion that her personal interactions with the patient contributed significantly to his recovery would be medically unfounded.
Admiral Sterling recognized the defensive tone in Dr. Thornfield's response.
She had heard similar evasions from subordinates who were protecting their authority against perceived challenges. The pattern suggested that there was significant tension between the hospital's official approach and Sarah's methods. Her next step was to interview other medical staff members who had worked with both Dr. Thornfield and Sarah. What she discovered was a clear division of opinion that reflected broader tensions within military medicine. Older, more established staff members generally supported Dr. Thornfield's position that medical treatment should follow proven protocols without deviation. They viewed Sarah's approach as potentially dangerous and certainly inappropriate for someone with her level of training and experience. But younger staff members, particularly those with recent military experience, recognized the value of Sarah's methods. They had observed her results firsthand and understood that wounded warriors responded to treatment approaches that acknowledged their identity and service rather than simply addressing their medical conditions. "She treats them like they're still warriors," one young corpsman explained to Admiral Sterling.
"That matters more than you might think.
When someone's been defined by their strength and capability their entire adult life, becoming a patient can feel like losing everything that made them who they were." Admiral Sterling spent 3 days conducting her investigation, observing interactions, reviewing medical records, and interviewing personnel throughout Walter Reed. By the end of her assessment, she had reached several conclusions that would have significant implications for both Sarah and the hospital. First, Sarah's methods were producing measurably better outcomes than traditional approaches, particularly for patients with severe psychological trauma accompanying their physical injuries. Second, her approach was being systematically undermined by hospital administration despite its effectiveness. Third, the tension between innovation and protocol was preventing Walter Reed from achieving its full potential in treating wounded warriors. But Admiral Sterling also recognized a more complex dynamic at work. Dr. Thornfield was not simply an obstinate administrator protecting his authority, he was a skilled physician genuinely concerned about maintaining medical standards and avoiding potentially dangerous deviations from proven procedures. His resistance to Sarah's methods reflected legitimate concerns about quality control and professional boundaries. The challenge was finding a way to support innovative approaches that worked while maintaining the medical excellence that made Walter Reed one of the world's premier treatment facilities. Admiral Sterling knew that the solution would require careful navigation of competing interests and strongly held beliefs about the proper scope of medical care. What she didn't anticipate was how quickly events would force a resolution to the tensions she had observed. Unknown to everyone involved, Commander Mitchell's case was about to take a dramatic turn that would bring all these underlying conflicts to a head and force everyone at Walter Reed to confront fundamental questions about the nature of healing and the true meaning of medical care. The crisis that would change everything was already building, and, when it arrived, it would test not only Sarah's commitment to her unconventional methods but also the courage of everyone involved to challenge established systems in pursuit of something better. The crisis began on a quiet Sunday morning when Commander Mitchell suffered what Dr. Thornfield initially diagnosed as a major psychological setback. After weeks of steady improvement, Mitchell suddenly withdrew into himself completely, refusing to participate in therapy, barely eating, and showing signs of severe depression that exceeded even his initial presentation. Sarah was not scheduled to work that weekend, but she received an emergency call from the charge nurse asking her to come in. "Something's wrong with Mitchell," the nurse explained over the phone.
He won't talk to anyone, won't respond to treatment, and Dr.
Thornfield is considering transferring him to the psychiatric ward. When Sarah arrived at the hospital, she found a scene that broke her heart. Mitchell was lying in bed staring at the ceiling, but his eyes held an emptiness that was somehow worse than when he had first arrived. All the progress of recent weeks seemed to have vanished overnight, leaving behind a man who appeared to have completely surrendered hope. Dr. Thornfield was conducting an emergency consultation with the psychiatric staff, developing a treatment plan that assumed Mitchell was experiencing a complete psychological breakdown that required immediate intervention with heavy medication and possible isolation protocols. "This is exactly what I warned against," Dr. Thornfield announced when he saw Sarah approaching Mitchell's room.
Emotional manipulation and amateur psychology have created unrealistic expectations that the patient could not sustain.
Now he's experiencing a psychological crash that's worse than his original condition. But Sarah suspected something different was happening. She had learned to read the subtle signs that indicated when a patient was dealing with specific trauma rather than generalized depression. Mitchell's withdrawal felt targeted and purposeful rather than random and chaotic.
Against Dr. Thornfield's direct orders, Sarah sat down beside Mitchell's bed and began talking to him.
She didn't expect immediate response, but she hoped to understand what had triggered this sudden change in his condition.
"Something happened," she said quietly. "Something specific that changed everything for you between yesterday and today." Mitchell's eyes flickered slightly, suggesting that her assessment was correct. "Was it news from outside? Something about your team, your mission, your family?" This time Mitchell's reaction was unmistakable, a sharp intake of breath and a tightening around his eyes that confirmed Sarah's suspicions.
Something external had triggered this setback, not simply the internal psychological pressure of recovery. Through patient questioning and careful observation, Sarah gradually uncovered the truth. Mitchell had received word that one of his surviving teammates, a young SEAL who had been struggling with his own recovery from the mission, had committed suicide. The news had shattered Mitchell's fragile sense of hope and confirmed his worst fears about the cost of survival. Dr. Thornfield's response when Sarah reported her findings was predictably dismissive. "Grief counseling and increased psychiatric medication," he prescribed. "The patient needs professional intervention, not amateur detective work." But Sarah recognized that Mitchell's crisis required something more specific than generic grief counseling. He was dealing with survivor's guilt that had been exponentially magnified by his teammate's death. In his mind, his own recovery had become a betrayal of everyone who hadn't survived, and continuing to fight for his health felt like dishonoring their memory. What happened next would become the defining moment not only of Sarah's career but of how Walter Reed approached the treatment of wounded warriors. Without authorization from Dr. Thornfield or approval from hospital administration, Sarah made a phone call that would change everything. She contacted Admiral Sterling directly, bypassing all normal channels and protocols. "Admiral," she said when the call was connected, "Commander Mitchell is in crisis, and I believe his life is in immediate danger. But the crisis isn't medical, it's spiritual and emotional, and it requires intervention that goes beyond what standard protocols can provide." Admiral Sterling listened as Sarah explained the situation, including Mitchell's reaction to his teammate's suicide and his complete withdrawal from treatment. More importantly, Sarah outlined her assessment that Mitchell needed to understand his survival as a mission rather than a burden, and that recovery required him to see his healing as service to his fallen brothers rather than betrayal of their memory. "What do you need?" Admiral Sterling asked without hesitation. Sarah's request was unprecedented in Walter Reed's history. She wanted to arrange for Mitchell to participate virtually in his teammates' funeral service, to hear eulogies from other SEALs who understood the complex emotions surrounding survivors' guilt, and to receive direct communication from SEAL Command about how his recovery served the broader mission of special operations. Dr. Thornfield was appalled when he learned about Sarah's unauthorized communication with military command. "This is a flagrant violation of medical authority and patient care protocols," he declared. "Ms. Chen has exceeded her authority completely and compromised patient treatment through emotional manipulation." But Admiral Sterling's response was swift and decisive. Dr. Thornfield, she said during an emergency phone conference, I've reviewed Commander Mitchell's case extensively, and I've observed firsthand the quality of care he's receiving. Miss Chen's approach has produced better results than anything your standard protocols achieved. With respect, Admiral, Dr. Thornfield replied stiffly, medical decisions should be made by qualified medical personnel, not by nurses acting outside their scope of practice. Commander Mitchell is one of our most valuable warriors, Admiral Sterling responded. His complete recovery is a matter of national security importance. I don't care about your protocols or your authority structure. I care about results, and Miss Chen has consistently produced the results we need. The confrontation that followed was unlike anything Walter Reed had experienced. Admiral Sterling arrived at the hospital with authority that superseded Dr. Thornfield's medical decisions, at least regarding active duty military personnel. She authorized Sarah's requested interventions and made it clear that Mitchell's treatment would follow whatever approach produced the best outcomes, regardless of hospital protocols. The virtual funeral service was arranged with technical support from military communications specialists. Mitchell was able to participate in honoring his fallen teammate while receiving support from other SEALs who had faced similar survivors' guilt. Most importantly, he heard directly from SEAL Command that his recovery was not just personally important but professionally essential, that his experience and leadership were needed to help other wounded warriors find their own paths back to meaningful life. The impact was immediate and powerful. Mitchell's withdrawal began to lift within hours of the service, and, over the following days, he resumed active participation in his treatment with renewed determination. But, this time, his motivation came from understanding his recovery as a mission to honor his fallen brothers and serve other wounded warriors. Dr. Thornfield watched these developments with a mixture of professional frustration and grudging recognition. The results were undeniable. Mitchell's recovery had not only resumed but accelerated beyond previous levels. Sarah's interventions had succeeded where traditional medical approaches had failed. But the success came at the cost of established hospital authority and protocol. Other nurses began requesting permission to use similar approaches with their own patients. Physicians found themselves defending treatment decisions that seemed less effective than nursing innovations. Most challenging of all, hospital administration faced questions about whether their commitment to medical protocol was actually serving their patients' best interests. The broader implications of Mitchell's case extended far beyond Walter Reed. Word of his remarkable recovery had spread through military medical circles, and other facilities began requesting information about the treatment approaches that had produced such exceptional results. The attention was forcing difficult questions about conventional medical care for wounded warriors. Sarah found herself at the center of attention she had never sought and didn't particularly welcome. Medical journals wanted to publish articles about her methods. Military medical conferences invited her to speak about innovative patient care approaches. Hospital administrators from around the country asked for consultations about treating psychological trauma in military patients. But the attention also brought increased scrutiny and criticism. Medical professionals who viewed her success as a challenge to their own expertise questioned her qualifications and training. Hospital administrators worried about the liability implications of encouraging nurses to exceed traditional scope of practice. Insurance companies expressed concern about treatment approaches that couldn't be easily quantified or standardized. Dr. Thornfield found himself in an increasingly difficult position. He couldn't deny the effectiveness of Sarah's methods, but he also couldn't abandon his commitment to medical standards and professional hierarchies that he believed were essential for patient safety. The success of her unconventional approach was forcing him to question fundamental assumptions about medical care that had guided his entire career. The tension reached a breaking point when hospital administration called for a formal review of Sarah's methods and their implications for Walter Reed's treatment protocols. The review would determine not only Sarah's future at the hospital but also whether her approach could be integrated into standard care or would be dismissed as an anomaly that couldn't be replicated safely. Admiral Sterling made it clear that she would be monitoring the review closely and that any decision affecting Sarah's ability to treat military patients would have significant implications for the hospital's relationship with SEAL Command. The stakes had escalated far beyond a simple dispute between a nurse and a physician to a fundamental examination of how military medicine should balance innovation with established protocols. As the review process began, everyone involved understood that the outcome would establish precedents that extended far beyond Walter Reed. The question was not just whether Sarah's methods were effective, but whether the military medical system was willing to embrace approaches that challenged traditional authority structures in pursuit of better patient outcomes. The answer to that question would come in a dramatic confrontation that no one anticipated, and that would force everyone involved to examine their deepest beliefs about service, authority, and what it truly meant to heal those who had sacrificed everything in defense of their country. The formal review of Sarah's methods was scheduled for a Thursday morning in Walter Reed's main conference room. The assembled panel included Dr. Thornfield, hospital administration officials, representatives from Military Medical Command, and external medical experts brought in to provide objective assessment. The atmosphere was formal and intimidating, designed to emphasize the seriousness of the proceedings. Sarah sat at one end of a long conference table, wearing her standard nursing uniform and carrying a folder containing documentation of every patient case she had handled differently from standard protocol. She had spent weeks preparing for this moment, knowing that her career and her ability to continue helping wounded warriors hung in the balance. Dr. Thornfield presented the hospital's position with characteristic precision and authority. Ms. Chen has consistently exceeded the scope of her nursing practice, he stated to the review panel. While her intentions may have been commendable, her methods represent dangerous deviations from established medical protocols that could compromise patient safety. He detailed specific instances where Sarah had made decisions typically reserved for physicians, had engaged in therapeutic interventions beyond nursing scope of practice, and had violated hospital authority structures. His presentation was methodical and damaging, building a case that Sarah's actions, regardless of their outcomes, were inappropriate and potentially dangerous. Medical care must be based on scientific evidence and professional standards, Dr. Thornfield concluded. Emotional approaches and amateur psychology, no matter how well-intentioned, cannot substitute for proper medical training and established protocols. Sarah's response was quiet but unwavering. She presented detailed documentation showing improved outcomes for every patient she had treated with her unconventional methods. More importantly, she provided testimonials from the patients themselves, describing how her approach had given them hope and motivation that traditional medical care had failed to inspire. "I'm not claiming to practice medicine," Sarah explained to the panel. "I'm claiming to practice nursing in its fullest sense, caring for the complete human being, not just managing medical conditions. These men and women are warriors who have sacrificed everything for their country. They deserve care that recognizes their service and treats them with the dignity and respect they've earned." The review process was thorough and contentious, with panel members asking detailed questions about medical liability, scope of practice, and the implications of allowing nurses to exercise the kind of independent judgment Sarah had demonstrated. Some panel members expressed concerns about establishing precedents that could undermine medical authority structures throughout the military healthcare system. But, as the morning progressed, something unexpected began to happen. Word of the review had spread throughout Walter Reed, and wounded warriors who had been treated by Sarah began arriving at the hospital requesting permission to provide testimony on her behalf. Staff Sergeant Rodriguez was among the first to appear, walking confidently on prosthetic legs that he had initially refused to use. Behind him came the young Marine who had struggled with anger management, now participating actively in a peer counseling program for wounded veterans. One by one, patients whose lives had been transformed by Sarah's care gathered outside the conference room. Dr. Thornfield tried to dismiss their presence as irrelevant to the medical review. Patient satisfaction, while important, cannot override professional medical standards, he argued. Positive outcomes in individual cases do not justify systematic violations of established protocols. But Admiral Sterling, who had been monitoring the proceedings closely, made a decision that changed everything. "I think we need to hear from the people who are most qualified to evaluate the effectiveness of medical care, the patients themselves." What followed was an unprecedented session where wounded warriors were invited to provide direct testimony about their treatment experiences. Rodriguez spoke about how Sarah's approach had given him the courage to rebuild his life after devastating injury. The young Marine described how she had helped him channel his anger into constructive action rather than destructive behavior. But, the most powerful testimony came from an unexpected source. Commander Mitchell, who had been medically cleared to return to limited duty, had been following the review proceedings with intense interest. Without anyone's knowledge, he had requested permission to address the panel directly. When Mitchell entered the conference room, the atmosphere changed immediately. Even seated in a wheelchair that he would need for several more months, he commanded the respect that comes from proven leadership in life and death situations. Every person in the room understood that they were in the presence of a warrior whose service had earned him the right to speak without challenge. "Dr. Thornfield," Mitchell said, addressing the physician directly, "you saved my life with your medical expertise. The surgical procedures, the medications, the rehabilitation protocols, all of it was executed flawlessly, and I owe my physical recovery to your skill." Dr. Thornfield nodded, clearly expecting Mitchell's testimony to support traditional medical approaches. "But," Mitchell continued, "Nurse Chen saved my soul." The silence that followed was profound and uncomfortable. Mitchell's words carried the weight of absolute conviction, spoken by someone whose credibility was unquestionable. "When I arrived at Walter Reed," Mitchell explained, "I was ready to die. Not because of my physical injuries, but because I had lost any sense of purpose or meaning. Your medical team repaired my body, but it was Sarah who reminded me that I still had missions to complete, still had ways to serve, still had reasons to fight." Mitchell turned to look directly at Sarah, and what happened next stunned everyone in the room. Slowly and deliberately, despite the pain it clearly caused him, Commander Mitchell rose from his wheelchair and stood at attention. "She understands something that medical protocols can't teach," he said, his voice carrying the authority of command. "She understands that healing warriors requires more than fixing their bodies. It requires honoring their service, recognizing their sacrifice, and helping them find new ways to live with purpose and dignity." Then, Commander Mitchell did something that had never happened in Walter Reed's history. In front of Dr. Thornfield, hospital administration, military medical command, and external review experts, he rendered a formal military salute to Sarah Chen. The gesture was unprecedented, profound, and unmistakable in its meaning. A decorated Navy SEAL commander, one of the military's most elite warriors, was publicly acknowledging that a young nurse had provided something essential that all the medical expertise in the world could not offer. The room remained silent as Mitchell slowly lowered his salute and carefully returned to his wheelchair. But the impact of his action rippled through everyone present, forcing them to confront fundamental questions about the nature of healing and the true purpose of medical care. Dr. Thornfield sat motionless, his expression revealing the internal struggle between professional conviction and undeniable evidence. Admiral Sterling watched the proceedings with obvious satisfaction, recognizing that Mitchell's testimony had settled the matter more definitively than any medical argument could achieve. Hospital administration officials exchanged glances that revealed their understanding that this moment would be remembered long after any policy decisions were made. External medical experts found themselves reconsidering their assumptions about the boundaries between medical treatment and comprehensive patient care. But the most profound impact was on Sarah herself. She had never sought recognition or dramatic gestures. Her commitment had always been to provide the best possible care for wounded warriors, regardless of whether anyone noticed or acknowledged her efforts. Commander Mitchell's salute was not just recognition of her methods, it was validation of her fundamental belief that healing required treating patients as complete human beings deserving of dignity, respect, and hope. When the panel reconvened after Mitchell's testimony, the tone of the discussion had changed completely. Instead of debating whether Sarah's methods were appropriate, they began discussing how her approach could be integrated into standard care protocols while maintaining medical safety and professional standards. The final decision was unanimous and unprecedented. Walter Reed would establish a new position, patient advocacy specialist, that would allow nurses like Sarah to provide comprehensive care that addressed both medical needs and psychological well-being of wounded warriors. The position would require additional training in trauma psychology and peer counseling, but it would also grant authority to make the kind of therapeutic interventions that Sarah had been providing informally. More importantly, the decision established a new model for military medical care that recognized the unique needs of wounded warriors and the importance of treating them as complete human beings rather than simply medical cases. Other military hospitals began implementing similar programs, and Sarah's approach became a template for innovation in trauma care. Dr. Thornfield, to his credit, embraced the new model despite his initial resistance. Perhaps, he admitted during the final review session, medical excellence requires more than technical expertise. Perhaps it requires understanding that our patients are more than the sum of their injuries. Sarah's impact extended far beyond Walter Reed. She began training other nurses in her comprehensive approach to patient care, developed protocols that balanced medical safety with psychological support, and became a recognized expert in treating trauma in military populations. But she never forgot that her success had come from simply treating wounded warriors with the respect and dignity they deserved. Years later, when Sarah was asked to speak at medical conferences about her innovative approaches, she would always begin with the same story about Commander Mitchell's salute and what it taught her about the true meaning of service. That salute had honored not just her efforts, but the fundamental principle that healing requires seeing patients as complete human beings deserving of comprehensive care. The conference room at Walter Reed where Commander Mitchell saluted Sarah Chen became a symbol of what was possible when medical expertise combined with genuine respect for patients as whole human beings. It represented a moment when traditional authority structures were challenged not for their own sake, but, in service of something greater, the complete healing of those who had sacrificed everything in service to their country. Sarah's story became legend within military medical circles, not because she had challenged authority, but because she had demonstrated that true medical excellence required treating patients with dignity, respect, and hope. Her legacy was not just better patient outcomes, but a fundamental shift in how military medicine understood its mission to serve those who had served their country. Commander Mitchell's salute had acknowledged something that medical textbooks couldn't teach and protocols couldn't mandate, that sometimes the most powerful healing comes not from clinical expertise, but from one human being recognizing the worth and dignity of another. In that recognition lay the true foundation of medical care worthy of those who had given everything in defense of freedom and justice.